my dad, Tom McDonald,
Hello.
and I am interviewing him about COVID 19 because that's our project right now. And he is a PA, and I'm just going to be asking him some questions. Alright. First question: why did you decide to be a PA?
First of all, for those who don't know what that is, because some people don't know what that means, I'm a physician assistant, and I've been a PA since 1995, and I graduated from George Washington University in Washington, D.C. And why did I become a PA? I wanted to work in healthcare, and I previously had worked with disabled kids and adults, and that got me more interested in healthcare, and I wanted to do something that would help people in the community with the quality of their lives, and I decided not to become a doctor because becoming a PA was a lot easier. I could start working within 2 years, and if you become a doctor, you have to be in school at least 7 years, and I didn't want to be in school that long, so I became a PA.
Alright. The next question: what are some challenges that you are facing in the COVID-19 outbreak?
Well, I work in a clinic. I work in family practice, and the big challenge right now, besides maintaining social distance and wearing masks and being extra clean at work, which can be hard, is the building where I work, we screen people at the front door when they come in, and we make sure that anyone who may have symptoms related to COVID-19 goes to a separate part of the building, and they get seen at a separate clinic. So that can be challenging to make sure that the people who are ill get the care that they need, and that we protect them and we protect the rest of our staff so that we don't spread any germs. So that's been the big challenge, I think.
I don't know what I write for that.
We can do the writing later.
Oh, okay. The next question: what are your thoughts on a vaccine for COVID?
A vaccine is going to be very, very useful, and any vaccine that is on the market has been tested very thoroughly for safety. There are a lot of rumors about vaccines not being effective or causing things like autism, and there is no proof that they cause autism, and the vaccine is likely going to be on the market early next year, and if it is approved by the FDA, which it will be, I definitely am pro-vaccine, and I hope to get it for me and for everyone in my family as soon as possible.
Yeah. Okay. The next question is: what are some common questions patients are asking you about this virus?
I think a lot of the questions they have pertain to whether they should be tested and how they should be tested. Unfortunately, in our country, we don't have access to testing as easily as I think most of us think it should be. It should be very, very easy to get a test. You should be able to test yourself at home. You should be able to go buy tests at Walgreens. We're not at that point right now, but I think at some point we will be. So a lot of people will have questions, and I'll interact with them over telehealth. So I basically take care of people over the computer sometimes, and they want to know whether they should be tested, or where can they get a test, or if they do have the infection, how long they will be contagious and when they can go back to work. So those are mainly the concerns that they have, questions along those lines. What else?
Okay. Alright, next question. What are the most common symptoms for COVID-19?
The most common symptoms, the first symptom for most people is fever. Other common symptoms are cough, shortness of breath, sore throat, body aches, sometimes GI or gastrointestinal symptoms like nausea or diarrhea. But the big ones are cough and shortness of breath and fever. Those are probably the big ones. There also are cases of people having a change or loss in their sense of smell or taste, and those symptoms are more common than what we thought, and if people complain about those, most people feel that that is very, very diagnostic for COVID, because you can have a cough and it could be from allergies or from a cold or from the flu or from pneumonia, but if you have a loss of sense of smell or taste, really no other infections cause that for the most part. So those are some symptoms that we look out for as well.
Alright. What is your opinion on the best way to prevent the spread of COVID-19?
Basically stay away from people who have the infection. The big challenge is that probably 40% of people who have COVID don't know that they have it and they have no symptoms. So because that's the case, you really should assume that anybody and everybody could have it, and you stay 6 feet away from people at least. Avoid any gatherings indoors. Being indoors for an extended period of time, unless you're at your own house, can be very dangerous. And wear a mask all the time, and wash your hands frequently, and if you feel sick, stay at home until you feel better and stay away from other people.
Alright, last question. Based on the number of cases in Wisconsin, when do you think public schools will be open to students?
I think they could be open on a limited basis, maybe part-time. I'm hoping early next year, and then full-time maybe in the fall. That depends on how things go over the winter and when we get a vaccine. So I'm hopeful that students will be able to go back to school at least maybe once or twice a week sometime in the spring.
Okay. Alright.
Okay?
Thank you.
Okay, thank you.